Thanks, Sarah, for joining us for a little chat. Sarah's about 7 months post-surgery now. Is that right, Sarah?
Yeah, 7 months. Yep.
Yeah, great. And she's had quite a journey in terms of the exercise or the physical activity side post-surgery, which is often an area that we find a lot of people struggle with. So we thought this would be quite a great topic today. So tell us a bit more about sort of what were some of your pain points or some of your main areas of concern prior to sort of, I guess, engaging in the whole exercise part post-surgery.
So I suppose I didn't really have any concerns. I was more wanting to get back in the gym side of things. However, obviously, you know, when I was overweight, re-entering the gym side of things was a bit daunting. So I suppose with assistance from Louisa, I suppose that was the biggest goal, was to get back at gym in a way that I wasn't going to, I suppose, feel anxious or, you know, and I suppose a way of feeling supported to enter that place again. Yeah.
Yeah, great. So before surgery, you sort of like to do a bit of exercise, and like you say, you wanted to re-engage in that. So you decided to come through to see Louisa, who's one of our exercise physiologists. And so, as you say, you know, there's often a bit of anxiety around, am I doing the right thing? Am I going to cause any damage to my surgery? What about, you know, at the specific time post-surgery, what should I be doing? And as you say, just the general feelings of trying to ease away maybe into that again, or even get started with that can be quite a big concern. So tell us a bit more about, I guess, the whole journey and the transformation that occurred from that after seeing Louisa.
Yeah, so Louisa and I met on a few occasions, and we put some, you know, in-home exercise plans together. And I just work with Louisa on them. So we built that up. We started off, you know, with a small 15-minute routine, and then we built that up to, you know, a 30-minute routine. And then I suppose I took that next step of, you know, buying myself some home-based equipment. And I suppose then that gave me even more motivation to, I suppose, get to the gym and use their equipment. So, you know, once I felt that my strength was built up to a certain level that I felt confident in going into the gym, I suppose then that's when, yeah, like Louisa and I felt that that goal had been achieved. Yeah, so I think that was, yeah, that's pretty much what we did. I suppose Louisa's strong side as well is that she's very motivational. So a lot of the times just even having a conversation with Louisa, you know, would give me that drive to, you know, make sure I am doing my exercises, or, you know, make sure that I am still, you know, working towards my goals. One of the biggest things with Louisa, I suppose, was, you know, always reminding me to check in with myself. So there was this saying that she once said to me, which was, you know, is what you're doing today making your boat go faster tomorrow? And I suppose the whole 7 months, I always check in with myself with that quote, you know, is what I'm doing right now making my boat go faster tomorrow? And I suppose the benefit of that is, you know, I've also got my partner who's now on board. And, you know, sometimes when I'm not making my boat go faster, you know, he will check in on me too. So I suppose, you know, just from, you know, her little intervention, I've, you know, grabbed a lot from her. Like, you know, I'm accessing gym now 5 to 6 times a week. My partner's accessing gym. You know, I've got all these motivational quotes that I'm left with. So yeah, I think, you know, Louisa's just not made it, you know, like exercise a harsh thing. Like, you know, before surgery, when I used to access the gym, I used to go really, really hard at gym. Be like, oh, let's lift as much as I can, like, you know, because I'm strong. Where I suppose with Louisa, she's made that, no, Sarah, like, that's not what we do. You know, we're building strength, and, you know, we function at about 75% rather than 110%. So, you know, just little things along the way to make it more enjoyable. So when I'm going to gym, I'm not feeling exhausted, that I am going to gym and feeling, you know, feeling good and confident, rather than, yeah, I suppose it burning me out.
I think there's some really little gold gems in there actually to take home from today. So I really like that saying, is what you're doing now going to make your boat go faster? And like you say, you could use it in all aspects of your journey after weight loss surgery, couldn't you? Not just with exercise, but with, you know, a whole lot of different things, your mindset, your eating, all that kind of stuff. So I think that could really really go forward with a lot of different areas. And it's also really nice to hear that you could start from home, couldn't you? And that's sort of something that people could even start now, I guess, is just starting a few things from home, whether they feel confident to do it on their own or if they do need to seek support from somebody. What you're saying is, even though you'd gone really hard in the gym before surgery, that wasn't where you started after surgery. You started sort of really, you know, in a bit more of a comfort zone and just took it nice and easy.
Yeah, nice and easy. And I suppose, you know, there was times where, you know, I'd said to Louisa, like, you know, I just feel like, you know, jumping on the treadmill and running. And she's like, you know, that's probably me with my, I suppose, energy from pre-surgery. So it's, you know, doing it in a safe way now and making sure that, you know, I'm not hurting myself or not burning myself out. So, you know, Louisa had, you know, put that into perspective in a much more natural way for me to, you know, to regain that strength back, I suppose, rather than, you know, going really hard at it and hurting myself. But yeah, even things that, like, I suppose I struggled with from the beginning was even, you know, meeting with friends, like, you know, before surgery, you know, catching up with friends at my age was, you know, around food and things like that. And Louisa gave me some hints, you know, around, well, why don't you go for a walk down the beach? You know, why don't you go to a market and go for a walk? You know, it doesn't have to always be around food, but I suppose mindset pre-surgery was, oh, we'll just catch up for a coffee or we'll just catch up for lunch. So, you know, I think with Louisa, there's a lot more than just the exercise part of it. It's also, you know, you've got that psychological factor of changing those bad ways or bad habits, I suppose. So yeah, I really liked that Louisa wasn't just, you know, so exercise driven or BMI focused. She was, you know, she was realistic about it all. Yeah. And, you know, helping you with other things. Yeah.
And that's a great tip to take away as well from today is, as you say, we always just think, oh, let's catch up for a coffee or food, but actually how can we sort of start to put exercise into the rest of our life? And it doesn't need to look like an exercise program for it to still be kind of beneficial as well. Great. So it sounds like you've had a really fantastic journey in terms of not just the surgery, but also the physical activity side of your surgery as well. And like I say, you've chosen to then move towards more of a gym-based program, but I'm sure there's sort of other aspects that you can go into as well. And I think that you mentioned to me that now you're confident enough, you and your partner are really confident enough to do this on your own, and you know you don't need that support anymore, which is great, because that's not what it's all about. We don't really want people to keep coming back time and time again. You know, the whole purpose is to sort of build people up to where they need to be, give them the confidence to go forward. Is that sort of how you feel through the whole journey?
Yeah, so I seen Louisa, I think, for about a 3-month period, and obviously we built my strength base at home, and then I moved into the gym sector, and then I just felt that, yeah, like I felt really confident. I felt like I'd blossomed, so I didn't need Louisa's support anymore. However, like I do know that if I ever did need some redirection, that I can always go back to Louisa and seek her assistance again. So yeah, I think that's the benefit here, is that, you know, Louise has built my confidence. We have achieved that goal of getting me to gym, and I feel like, you know, that's achieved. Yeah.
Great. It's nice to know that you're not locked into something that you have to go to it time and time again, that it's there when you need it. Which is excellent. Any personal tips that you've got for people who are embarking on exercising after surgery?
Yeah, I think just, you know, I suppose all our surgeries are a tool, and I suppose how you choose to use that tool is how you will get, you know, the best results. So, you know, I think at the start of everything, you know, try and engage in as much as possible. You know, put your feelers out there. You might not have, you know, used an exercise physio before, so, you know, give it a shot and see how you go. Like, I know for me, it's really worked, and it's not only worked for me, but it's also worked for my partner. You know, hearing these motivational quotes, and, you know, him coming along to gym, and, you know, him making, I suppose, behavioral changes as well. So, you know, I personally feel like, yeah, just give everything a shot. You know, it is a tool, you know, just try and see how you go.
Yeah. Excellent. Well, thank you so much for talking with us today. It's been really insightful, actually, to know a bit more about your journey and just the different options that you can take in terms of exercise, and the different little tips that you've built up along the way. I think that's really, really helpful for a lot of people on their journey as well.
No worries. Thank you.